I deal with a lot of patients that have chronic pain issues. Actually, we all do to some levels. It's just, for some people, it's a daily way of life. I mean, they're having severe arthritis, rheumatoid, lupus, all kinds of conditions, reflux, sympathetic dystrophy, just dealing with major pain issues all the time. And yeah, there's a lot of different ways you can treat that. We like sound a lot. Dr. Soren and I both use, uh, there's pain management CD, there's others for deep relaxation that will take you down. Something we'll talk more about is spatial angle modulation, which can take brain waves and kind of recycle through and reset the thermostat, which is being used with some veterans with PTSD and substance abuse problems with promising success. Um, just taking you down to where you can get very relaxed and mellow and kind of get away from that pain cycle, because you get this pain, more pain. It escalates, stimulates the sympathetic system. If you can quiet that down and kind of re-educate your body, because it's been a long time since you've experienced that. Um, when I do Reiki sessions, I always play the hemisync in the background, and so I'm doing a lot of sessions for pain issues, and they'll wake up just radiant, feeling so much better, and really constantly amazed about how such a simple experience in such a short amount of time can improve their overall well-being. So for chronic pain, for acute pain, I've done it in the hospitals, both in regular patients, in ICU patients, in major automobile accidents and such. There was a 17-year-old I was asked to see because she had been thrown out of a pickup truck. I'd actually taken care of the driver, who was also severely injured. And she had a compression fracture of her first lumbar vertebra, just been compressed down. She had a lot of other injuries as well, including a liver laceration, which her blood on arrival had been normal, about 40%, and a short time later was 14%. Normally that's incompatible with life, but she was aggressively transfused and brought it up to 27%. Still very anemic, but survivable. And she was in the ICU 3 days, wasn't able to get out of bed, severe pain. So I was asked by the family if I would see her, and her surgeon was the chairman of surgery at the time, also asked for that, and we stopped in and did a 30-minute session of Reiki and Hemisync. And the interesting thing was that she was able to get out of bed and walk to the bathroom immediately after. We did 4 different sessions. When I went up to see her for the 4th session, she was illegally out of the surgical intensive care unit down in the lobby. We had to have her paged overhead to get her back up. And her blood count, which had been 27% for 3 days, went from 27 to 36%, which is the equivalent of a 3-unit blood transfusion. That would be $1,500 in cost, no risk of HIV, hepatitis, or other issues. And her pain dramatically improved. So these are all great, easy, simple techniques to make one feel better and enhance your health.